It's California Edition. I'm Brad Pomerance. Glad you're with us today. Our guest is Fiona. She is a member of the California State Assembly. She's actually the Speaker Pro Tem. We thank you for joining us. And I want to speak with you about a few issues. First, health care. As we speak today, we don't know what the U.S. Supreme Court is going to do with the Federal Health Care Act. But what we do know is California has already been implementing its own health care reform, be it dealing with pre-existing conditions, health benefit exchanges. You're also looking to create California's version of health care reform.
Exactly. My bill, AB 1800, would cap the out-of-pocket medical costs. We all know that the #1 cause of bankruptcies are medical costs. 1.5 million Americans is going to have some sort of cancer, and cancer patients, an average cost is about $1,200 per month, and if they don't have adequate health insurance, it's going to be a problem for them to get all of their treatment and their medication.
Now, here's the challenge, though, is as we look at the last decade and into this decade, we know that employers, and we thank them for covering us, but they are increasing the amount that their employees need to contribute, be it through co-pays or be it through direct contributions. Is there anything the state can do on that front, or is this really a separate matter?
Well, this is really ensuring that the patients get the necessary medication, treatments, surgeries that they need, and not be prohibited because the insurance company says we don't cover it or we're not going to cover you.
Sure.
When people have a debilitating illness, chronic disease, or even an accident, they're not necessarily prepared for the high medical costs. And so this is really going to protect consumers and make sure that they can continue their quality of life, get back to work as soon as possible.
I want to talk about another health issue, and that is lung cancer and diseases related to smoking. As you know, this past June, there was an initiative on the ballot which would have increased the tax on cigarettes per pack by $1. Heading into the election, polling had it at above 60%. As we speak today, it appears it will go down to defeat. Many folks are concerned, those that support Governor Brown's tax initiative in November, that if the state won't even pass a tax on cigarettes, how is it they will pass a tax on themselves dealing with sales and dealing with high-income wage earners?
Well, I was really surprised at the result. You know, for I think many Californians, they are not smokers, and so it wouldn't impact them directly to vote for this tax versus others like sales tax,
right,
which would affect everyone. So I am not sure whether the advertisements worked, that the money would not go where it was intended to go, or people are just not happy with taxes in general. And what's next?
So does that cause you concern? Because I understand that you're a supporter of Governor Brown's tax initiative. Right. And I mean, he has said that if the initiative fails, there will be draconian trigger cuts to education. I mean, even now, the Cal State system, every campus has announced that they are waiting to see what happens with the tax initiative, because if it doesn't pass, they will have to decrease enrollment. They're waitlisting everyone come fall of 2012.
Right. Well, and I think the education community has the greatest stake in the November tax initiatives. Right now, schools, for example, are adjourning early because of the budget cuts. Teachers are getting pink slips. You know, the higher education. So I think this is serious. We have cut to the bone. This is $8 billion in additional temporary revenues to help us get through the tough times. This is my 6th year, and I haven't seen a budget surplus.
You have not.
Some years worse than others, and this is probably the worst I've seen.
In terms of cutting to the bone, we have heard that we have cut as many places as we can, but even in the governor's May revise, he said that the state spent $2 billion more than it was supposed to have spent. And that really does play into the narrative that we still have a spending problem. Do we have a spending problem?
I think there's chronic problems in the deficit in the budget. One, obviously, is healthcare, right? As more and more people are living longer, that's great, but it means that the healthcare costs are going to go up for everybody, retirees, and as well as just you know, the average citizen, you and me. So that impacts the budget. Secondly is pensions. again, people living longer. I don't think the pension system was meant to support an individual in the last third of their life. People are living longer in retirement than they are working.
Let's talk about pensions if we can, because as you know, there are two currents moving forward. First, the governor submitted a 12-point pension plan last year. The Republicans have submitted that very plan without changing a period, a dot, a comma. So you have that. You also have the cities of San Diego and San Jose overwhelmingly passing pension reform. And so it seems as if, and you have Wisconsin affirming a Republican governor who came out very strongly against public pensions. Are we getting to a point, Madam Speaker, that we need to have pension reform? The public is crying out for public pension reform?
Well, absolutely. I think pensions are the kind of one of the drivers in any budget, whether it's at the state level or at the local level. So we definitely do need reforms. I think people are understanding that in order to balance our budget in the long term, we have to relook the age that people are retiring, how much a person is putting in versus the government, for example. But
here's the challenge. I mean, we hear the Democrats in the Assembly and the Senate say, yes, we need pension reform. But not much has happened. I mean, the Republicans, you know, they triangulated pretty well on this one. They submitted the governor's plan, the Democratic governor's plan. Yeah. Is leadership in Sacramento on the Democratic side hearing the voices from San Diego, from San Jose, from Wisconsin that we better do something this summer on pensions or we're going to see an initiative on the ballot?
Yeah, no, I certainly heard it loud and clear. I was kind of surprised at the numbers in San Diego and San Jose, which is very close to my hometown, and so it means that other cities... And a fairly
liberal city. I mean, San Diego a little more mixed.
Right.
San Jose, I mean...
Right, and so I think as leaders, we need to hear the call to action, and we need to lead by example. We need to make sure that we do have the reforms, that we are looking for future budgets, deficits. I am done after 6 years. I've done my best to make reforms. Leaders coming in are going to have those tough decisions, and I think everyone has to come to the table, both sides. And that's why I was hopeful for the open primary system, is that we would elect more moderates to the legislature and we wouldn't have this polarization of the parties.
Could be argued that didn't go well for those that were looking for moderates. If you look, for example, a congressional race in Ventura County, an independent was running, endorsed by some major papers. She was beaten by a Democrat and a Republican. If you look at races where there are two Democrats running against each other in Congress, 7. Do you think the open primary worked?
It didn't work this time. I think it's going to take a couple of cycles before declined to state voters are used to voting in a June primary. I know down in Ventura and Santa Barbara, the turnout was 25%. Right. And before the polls closed, the absentee ballots had already determined the race. The people that traditionally vote by absentee early, which is, you know, the perennial Republicans, Republican Party folks, and the Democrat, progressive liberal Democrats, and that's what we got. So we're back to what it was.
But here's what's interesting. There was a term limit reform initiative on the ballot that does not impact current members, but it really changes the face of how people will serve in Sacramento. Now, with this incoming class, a member can serve 12 years in either house.
Right. And I think it's a good thing, right? 6 years is too short in order to get anything done. I mean, by the time you learn the process and you're really successful in understanding how things work around here, we're termed out. 12 years is a longer period of time, so it gives members an opportunity to work on bigger picture issues, whether it's, you know, the water crisis or emergency preparedness, things pensions, people that issues that are bigger in nature.
Fiona, I want to thank you so much for joining us. She is the Speaker Pro Tem in the California State Assembly. When we come back, we'll be speaking with one of her colleagues in the California State Assembly. His name is Martin Garrick. I'm Brad Pomerance. We'll be right back on California Edition.
Who served as Speaker Pro Tem prior to Fiona Ma? John Perez, Karen Bass, Alberto Torrico, or Lori Saldana? Lori Saldana of San Diego served as Speaker Pro Tem prior to Fiona Ma's accession in March 2010.
It's California Edition. I'm Brad Pomerance. Glad you're still with us. Our guest, Martin Garrick, member of the California State Assembly. And sir, as you know, since 1967, California has had a full-time legislature. The voters passed that provision in 1966, 3-to-1 margin. I recently spoke with Shannon Grove, one of your colleagues. Both she and you are advocating to change the status of the legislature to part-time. Very grand experiment. Talk to us about it.
Well, it does sound like a grand experiment because it started back in '67, but that means that prior to '67, that means for 116 years we had a part-time legislature.
But a different state back then, obviously.
A different state, but yet so much the same. Still geographically the same, still as beautiful as it ever was, just a lot more people. But there are, out of our 50 states in the United States, only 6 states that have full-time legislatures.
But let's talk about the makeup of our state. Like you said, we are a large state, a large population, 37 million, I believe.
Right.
I mean, some would call it a country.
Right.
And we're the 9th largest world economy. Couldn't one argue that we want our legislators to spend have their full attention focused on the matters of this state, as opposed to working part-time in the legislature, part-time doing something else?
You could make that argument. My counter to that would be that in the 6 years that I've been here in the legislature, having been elected in '06 and starting to serve December of '06 through this coming December, that there have been 15,900 bills proposed. I think that's too many laws, too many bills, and if you were to go back to the original part-time legislature, like other states, like Texas with 28 million people has a part-time legislature, meets every year, first year for 120 days, second year for 30 days, you would be able to concentrate your efforts and time on the priorities of the state and not come up with bills like dogs on your lap.
But who could
making
serve,
those illegal.
Who could serve as a part-time legislator? Who would be able to do that? I mean, I think about, you know, if you have the ability to take 120 days off, let's say, you really limit the scope of people that can do that.
Well, again, I might say that there's flexibility in many businesses, both small and large, depending on whether they're family businesses or corporations, also the professions that you have, whether you're a lawyer, a doctor, or other professions that have partners. The partners are willing to, in many times, cover or support you while you cover for them when they're on their vacations.
But 120 days, I mean, that's a long time if you're a teacher, if
I'd like
you're
to
a
make
lawyer.
it shorter.
But look, we are a very large state.
Yes,
and
we are.
I would think that we would want to be able to attract as many people as possible to our legislature. And you know, I'm a neutral journalist. It just, you know, when I look at the issue, the concern that pops up is who will be able to run? It would seem to me it would be the retired, the wealthy, and those that happen to be small business people. I mean, I couldn't take 4 months off. I'd lose my job. A teacher couldn't take 4 months off. She or he would lose their job. It's limiting.
Well, and yet those same individuals you just identified now are required to work full-time and give up their jobs. And so
it's a choice.
It is a choice. And again, you have what we're calling, in my ACA, that's, excuse me, Assembly Constitutional Amendment 28, comes back with the fact we call it a citizen legislature. Just like the Founding Fathers originally wanted, they went back to their farms, to their print shops, to their businesses.
Such a different time. I mean, they could do that back then. When we
sometimes, again, it may be the fact that we have 46 other states, 44 other states, depending on how you count a full-time, what number of days requires the definition of a full-time to be applied. The fact that other states do comply with that or are in line, like Texas, like Florida, others that have Florida with 18 million, Texas with 28 million. Let me share a few facts with you. Besides the 15,900 plus bills in just 6 years, that we also have a budget to take care of 120 legislators and their staff annually. This past year was $257 million. With a part-time legislature like other states have and the same salary that other states implement or less, you would have $57 million or less in expenses and leave $200 million in the citizens' pockets.
No doubt, no doubt. But let's harken back to the term limit reform movement, for example.
Sure.
We passed term limits, I think it was 1990, it went into effect a couple of years later.
Yes.
And whether you're a Democrat or you're a Republican, and I've heard this from both sides of the aisle, the concern has been with the term limit movement is that we are losing expertise. That because you're leaving, in December,
correct.
You've really, I know your reputation. It's a positive one.
Thank you.
But you're about to leave just as you are really becoming an expert in a certain area. If you are a part-time legislator, how can you become an expert in water, an incredibly complicated issue, in pensions, and higher education? I mean, look, I know I'm pushing you, but I think it's worth it. You're up to the task.
Absolutely. Those are all valid questions, and it relates to the fact that when the individual goes back, what fields are they in and what are their interests? And if you're able to serve on those committees and with a part-time legislature where your expertise could be applied to and knowledge to the issues that confront our state as each piece of legislation comes forward. It would also require us the first year, because my ACA would require a 2-year budget. So we'd have a little more financial stability.
Now, what's interesting, some of the ideas, some of the reasons for supporting your initiative make sense. A 2-year budget. Could we not implement that short of a part-time legislature? Could we not limit the number of bills? I mean, I think Assemblyman DeStandy has proposed limiting the number of bills. Could we not take small pieces of your ideas and not throw out the baby with the bathwater?
We could, if there was the will in the Assembly and the Senate, to go to a part-time legislature or go to, as you said, a 2-year budget. As to the limiting the number of bills, there's the contrast or the balance. By limiting the number of days, you would naturally limit the priorities that you would be working on and therefore the number of bills. But you wouldn't be imposing an artificial number and, in my opinion, thereby limiting free speech. If there's a need for certain bills, then you should be able to write those bills.
I want to talk about the balance of power, the separation of power, also stated. When you think about the fact you have a full-time legislature, that means that they are here, all 120 of you are here as a check on the governor, the executive branch, all the regulatory agencies that the governor controls. If you're not in session, if you're not here, you're not a check. And one could argue the power of the executive branch gets that much greater. Is that of concern to you?
Well, I account for that possibility in the fact that we can have emergency sessions of up to 30 days. If
called
there were,
by whom, though?
It could be called by the governor, or I would like to see it also called by potentially the leaders if there were a statewide emergency. But also the issue, as you identified it, that the executive branch is just that. He is the executive, and he is the leader of the state. The legislature are the citizens that go back and live under the laws that they make. And they are very in touch with and would carry the message back when they come back for their legislative sessions of what is needed and what is not needed in the state of California.
As you know, the voters recently passed term limit reform.
Correct.
And what that bill, what that law will now do, it will allow a member, starting this fall, those elected this fall, to serve 12 years total in either house, as opposed to 6 in the Assembly, 8 in the Senate. Could one argue, looking at that vote was overwhelming, that voters are looking for experts? They're not looking for people to come in and out. They want people to really know what they're doing.
One might argue that. I might take the counterpoint in that the voters believed, because of the sheer numbers, the simple numbers of the present law that has been in effect since 1992 of the original term limits, was a maximum of 14 years, the new one being 12, that the voters saw a need for even a shorter period of time and imposed that.
One could argue.
So that would be my perception, and in talking to voters, that generally was their immediate perception and encouraged them to vote for it.
I want to thank you for getting us thinking, because that is what you did. His name is Martin Garrick. He is a member of the California State Assembly. My name is Brad Pomerance. We'll be right back on California Edition.
In 1990, California voters imposed term limits upon members of its Assembly and Senate. What percentage of the voters favored the measure? 50.52%, 52.17%, 53.64%, or 54.79%. In 1990, California passed legislative term limits by a margin of 52.17% versus 47.83%.
Welcome back to California Edition. I'm Brad Pomerance. Our guest, Dan Logue, member of the California State Assembly. And sir, I want to speak with you about health care in California and in the nation. As we speak today, we don't know what the U.S. Supreme Court is going to do with regard to health care and the Obama Health Care Act. I want to talk, though, about the mandate, the individual mandate. As you may remember, back in the 90s, President Clinton had advocated for an employer mandate, and many conservative organizations said, we want an individual mandate. Well, now it's the conservative organizations that are opposing the individual mandate. Is mandate just wrong in the end?
I think it is. The bottom line is that, America was built on the premise that if you want a service, you should pay for it. And if you don't want the service, you should not have to pay for it. But what we have is a bigger challenge in California is if Obamacare, bottom line, my concern is that the Supreme Court is going to throw the mandate out, declare it to be unconstitutional, but they're going to allow the states to implement the mandate on a state level. And I think they're going to come back and say, the federal government, this is unconstitutional, but on a state level, the states, based upon the Constitution Amendment number 10, that they'll be able to implement a Massachusetts-type healthcare process.
Which was signed by Governor Romney, the Republican nominee, ironically.
Correct.
But here's the challenge as it relates to healthcare. If you need healthcare, you are going to get it. And if you don't have insurance, you and I pay for it. So if we don't have an individual mandate requiring one to have health insurance, like we do with automobile, for example, how do we fix the system?
The problem goes beyond that. Just because if you have Obamacare and you want your health care to be covered, there's no certainty that it'll be covered. They're going to have to look at a level of rationing and making determination on who gets that health care and who doesn't. So if you have a person who's 75 years old and they need a hip replacement, and you have somebody who's 26 years old and they need a hip replacement, there's a good chance because of the costs running out of control that may not be the resources to comply with all the requirements. That's where the real concern comes from.
But aside from President Obama's plan, I want to talk more philosophically. I mean,
Sure.
You're a thinker, so I want to get a sense from you. Really, the fundamental issue is, what do we do about the uninsured? Because, look, if the U.S. Supreme Court strikes down the Obama plan, the Republican Party is going to have to come up with something.
Absolutely.
And so what is that something? I want to know, because I have a wife with a chronic health condition. Our medical bills are out of control. She has a pre-existing condition. I mean, there are a lot of issues facing everyday Americans.
That's right.
And so I'm trying to get a sense, what do we do? Forget my wife, the uninsured. They don't have a primary care physician, so where do they go? The emergency room, the most expensive place.
Yeah, but that's not the only place where they go. In my county, we have healthcare facilities that take care of people who are uninsured. They're able to be taken care of. Del Norte is one. Peachtree Healthcare Clinic, which I was a board of directors, took in patients all day long. They serviced them, they took care of them. And the bottom line is this, is that if we want to fix the healthcare process, we have to look at tort reform. Nobody talks about tort reform. The cost of doing business in America and California for physicians, I met with them last week and they said, because of litigation is so high, litigious nature of this country, is that they end up doing 20 tests when they really only need to do 3 or 4 tests. And that's an issue that needs to be dealt with.
We do have a cap in California as it relates to punitive damages.
Yes, micro.
So you can get up to $250,000 for pain and suffering.
Yes.
So in California, there is some resolution on the issue. I'm not saying that tort reform shouldn't be looked at. But let me ask you about this then. As part of the Obama plan, the legislation directed the states to set up what is known as health benefit exchanges.
Yes.
So small businesses can use collective power to negotiate better insurance rates. Governor Schwarzenegger signed that bill a couple of years ago. What do you think about that plan? Are you supportive of the health exchange notion?
No, I don't support the exchanges. I think it's a step in the wrong direction. What you're doing is you're actually putting the government between the physician and the patient, okay? The exchanges are based upon people who cannot afford, need to supplement their health care benefits is what you're talking about.
Well, no. I mean, we could be talking about different things, but let's say I own a small business and I want to get health insurance. I'm not part of an association, I'm not part of a union or a large corporation, so I don't have the negotiating power. So my small business insurance will be higher. It's a smaller number. With the health benefit exchange, small businesses can pool together, and then that exchange will negotiate a better rate.
But it's a mandate for them to do that. They have to, the insurance companies have to pull together. And right now, I can go out and get my own insurance and get a pretty good rate if we're allowed to compete with cross state lines. That will bring the prices down.
That's actually a very interesting issue.
And that's a better route to go. Okay, I think the exchange is one step towards having basically a non-participation government-controlled healthcare from top to bottom. It's a step in the wrong direction. Competition is good. Competition brings down the cost of healthcare.
Wouldn't an exchange be competitive, creating competition?
No.
So what does California do if we have to go on our own?
I think that we take a hard look at what the Supreme Court decides. If the mandate is unconstitutional, that we can look at alternatives, such as the internet and high-tech industry now is coming up with ways to save billions of dollars. I had a bill called telehealth medicine.
Sir, I know all about it. It has been seen as a model for not just California, but for the nation to allow the delivery of medical services through the web, be it just text or be it through video. And
especially in the urban and rural areas where you have the poor, you could have a head injury up in Bernie Falls and have a physician from the University of San Francisco look within 5 minutes. And that's the kind of technology that I believe is going to drive our healthcare standards to be the highest standards in the world, which they are now.
And the telemedicine bill passed with bipartisan support and has really been seen as a model for the rest of the nation. So if Dan Logue was able to get a bipartisan bill through the Assembly and the Senate, can he do it for other elements of health care?
Absolutely. The bottom line is to get the cost of health care down and make it competitive so the people can bring the price down. Look at tort reform where we don't have physicians having to get 25 different tests when it only requires 5 to lower the cost, allow for interstate competition for insurance companies, and concentrate on the high-tech industry of healthcare. I think that's where the future is for California, and I think that'll be a better service for the people of California. If you don't, there's no doubt in my mind that you're going to have massive rationing. The governor of California knows that the cost of a healthcare program will be massive. It'll cost us, right now, Obamacare is estimated to cost us $1.7 trillion a year.
Let me ask you about decreasing the cost of health care. You know, in 1988, California's passed Prop 103, which dealt with the regulation of auto rates. And since that has passed, car premiums have declined about 30%. There is an initiative being circulated that would give the insurance commissioner more power over health care insurance. Do you think that would be one way to bring down, using the model from auto insurance?
I'm not sure. It depends on I don't know if I want to give the commissioner more power. I think the free market will bring the prices down.
But it hasn't, though, as it relates to health insurance.
The rates keep going up. It really depends on who the commissioner is. I mean, if the commissioner comes in and says we want more mandates on that coverage, it's going to drive the cost up, and I think Mr. Jones is absolutely going to do that. That's what his philosophy is from the day he's taken office.
But there have been Republicans. Chuck Quackenbush was the insurance commissioner. I mean, a Republican could take that office. So for the greater good, would you consider supporting?
I wouldn't consider it because I couldn't have the guarantee that whoever was stepped into that office wouldn't increase the mandates and put it on the back of the people of California. The essential benefits could go through the ceiling and we'd lose control of that. I think those costs have to come down or we're going to end up rationing, and that's the biggest fear I have is healthcare rationing from top to bottom. I think Obamacare is going to implement it. You have it in Canada, you have it in England. Everywhere it's been implemented, you've had rationing in degrees of care.
We're heading towards socialized medicine?
Absolutely. This is what it is. I mean, it's kind of like putting the Department of Motor Vehicles in charge of my health care. I would never trust the government to make the decision on whether or not I lived or died.
Dan Logue, thanks for joining us. Member of the California State Assembly, I'm Brad Pomerance. Thank you for joining us on California Edition.